Okay, so yesterday we were talking about Lyme's disease, which the infectious agent is actually Borrelia burgdorferi. So make sure you know Lyme's disease is Borrelia and transferred. Oh, thank you. I actually had time to curl it this morning, so I appreciate that.
You.
um,
Yeah.
okay, so now we have to move on to
Or something.
um, erhlicia. Is someone talking to me? My speaker is low. Sorry. If no anyone had a question.
Are you unmuted?
Um, Let me just do a mute. And if you have to answer a question, sorry, I just heard some talking. Okay, so ehrlichiosis is another group, and we talk about this group as a species, but ehrlichiosis organisms typically infect the white blood cells. So this is another blood-borne um, illness spread by ticks. And when we talk about, and when they attack the white blood cells, basically they enter the white blood cells and they form a mullure, which is like a structure, and it's got these bacteria, and it's considered an intracellular parasite because it does live inside the white blood cells. Typically spread by either the brown dog tick or the Lone Star tick, which are kind of the common names. It does have acute, subacute, and chronic phases. And, you know, if we talk about acute, meaning they've been usually acute, and obviously acute means right now, they've been infected within 4 weeks. And sometimes they can recover from this on their own. You know, anytime something infects the white blood cells, the body still has a chance to technically fight it. Whether it's going to multiply depends. So they can have vomiting and diarrhea, lameness, but what happens is they can also get hind leg edema. So the back legs might appear swollen to the owner, and sometimes the swelling contributes to the lameness. Obviously, the more swollen their joints are, and this tends to affect the hind legs. They can get ocular and nasal discharge and potentially maybe some difficulty breathing. And again, a lot of this is basically, you know, these signs can mimic a lot of other diseases. So again, history taking is important because anything that is spread by a tick, typically someone's maybe been hunting or camping or hiking in the woods, especially with long grasses. So, you know, getting that history, because again, sometimes the tick, like I explained yesterday, the tick bites, falls off. The owner never found a tick, and sometimes they don't see that bullseye pattern. But if they have a bullseye pattern, they've recently been camping, it kind of might point the doctor into this direction. Now, subacute means, now it's kind of subacute and subclinical, means maybe they are carrying the disease, but they're not showing signs of the illness. So what can happen is that the bacteria do infect the white blood cells, and the body has a chance. So they didn't get enough of an infection to necessarily make them ill. So they can either harbor it, and then they're going to develop signs later, like chronic stages, or the body can take care of it and then they don't have any clinical signs of the illness. Now, if they're chronic, then what happens is gradually the animal, and this is like over 4 weeks, but you know, after 4 weeks, but they can have chronic weight loss and anorexia. And again, anorexia and weight loss, there's a lot of illnesses that can cause that. But then a history of fever. And anytime, and this is just a good tip for you guys, anytime an animal has a fever, do we see any outward signs? Like if they have a UTI and they have a fever, usually there's urinary symptoms. If they have a cough and a fever, maybe they have pneumonia. They have nasal discharge and a fever. you know, so if we have an animal that has lameness and a fever and no other really accompanying signs, that kind of points us in a direction, you know, because a fever is not normal. Anything above 102.5, unless you are out on a sunny day with your dog and they're maybe warm, normally a fever is fairly significant. But edema in the hind legs, the scrotum, or the tail, so kind of near the back end. And anything that affects the lymph nodes can affect lymph drainage. And that's kind of what causes this edema, is it impacts that. They can potentially get into bleeding disorders and can get pale mucous membranes if it continues to move on. So now, if humans are to get this, because again, we can get this from a tick, we would have the fever, the flu-like symptoms, the fever, the achiness, you're just tired all the time. And then potentially, remember, leukopenia, leuco is white, and penia is low white blood cells. So it can give a low white cell count. And anytime you have a low white count, animals or people, you kind of feel lethargic, tired, because you just can't fight off normal illnesses. So typically there is the clinical presentation. So it's diagnosed, you know, the clinical signs, a history of camping, hiking, you know, things like I said. Potentially they have noticed that a tick bite target pattern and they found a tick. Obviously, if you've got those clinical signs and the owner did remove ticks, that's kind of a glaring, you know, you have to look for these illnesses. And then you can do serology serum testing for this. IDEXX makes the 4DX test, and there is an IDEXX 3D test. So you can potentially do this testing in your clinic if you have these tests, or these can be sent to the lab. Usually IDEXX, you send it to the lab and you do the 4DX or the 3, I think the 3DX you can get in the clinic, but usually sent to the lab. Now, the treatment for this, antibiotics with tetracycline. Now, tetracycline is not a common antibiotic used. You have to also use caution if they're young with tetracycline. But if you hear doxycycline, tetracycline, the cyclines are used a lot for these bloodborne pathogens. You know, doxycycline is usually the treatment of choice. And so if they don't have tetracycline, they might choose to use doxycycline. And I'll say something that's maybe frustrating for owners is sometimes when we do these testing, you know, sometimes the tests are inconclusive or you can get false negatives. And maybe the doctor still suspects ehrlichiosis or Lyme or whatever. Sometimes they will choose to treat the animal. Let's just do a course of doxycycline, or let's just do a course of tetracycline and see if they improve. So sometimes even if there's a negative test, and you know, sometimes owners are like, well, then that means they're negative. But a lot of times this testing, we do have to be careful of those false negatives. And sometimes, yes, and doxycycline used in people, and it's a fairly strong antibiotic. But you know, what a doctor would usually just explain is that, well, let's see if they improve on like a 3-week course of these antibiotics. And if we see improvement, potentially it was a false negative. So there is Ehrlichia canis here at the top, I forgot to mention, and Ehrlichia ewingi. So, but generally we refer to it. Yes, it can cause skin sensitivities, doxycycline, and again, we worry about enamel formation in young animals, so that's why usually tetracycline or doxycycline, if they're younger than 6 months of age, while those adult teeth are forming, they might have to use like amoxicillin. And again, the gold standard is the doxycycline or tetracycline. Now, there is, it used to be called Ehrlichia platis, but there is anaplasma. So generally, when we're talking about tick-borne illnesses, Lyme's, ehrlichiosis, anaplasma. And so sometimes they're just called the anaplasma group, or that your dog is positive for anaplasma. And what this can do is this will cause an infectious thrombocytopenia. Now, it doesn't tend to cause systemic illness. We're talking about like fever and swelling and things like this. But, you know, what is a thrombocyte? Let me just throw that out there. Anyone remember what a thrombocyte is? It's a platelet. And so if an animal is thrombocytopenic, which means they don't have enough, what clinical sign? Well, if you look down a little bit here, but instead of seeing like coughing, difficulty breathing, swelling, the owner may just know petechia. And if you have not talked about petechia yet, they're little pinpoint hemorrhages under the skin. They look like kind of like little bruises, or even sometimes they just look like little red splotches. And the problem is where they have a heavy coat, where they have a thick coat, they're sometimes hard to see. So sometimes you can look on the inner conjunctiva, the inner part of the eyelid. Sometimes you can lift up the gums if they have pink, or like the inside of their lip, not necessarily on the gums. Obviously, their abdomen or their inner back legs. Those are some places, if we're worried about petechia for any reason, those are some of the locations that we look. So if you have a very astute owner that says, wow, there's like little splotches over my dog, it's very abnormal for dogs to bruise. We don't see a lot of dogs with bruises. But instead of looking like one deep purple bruise, which they can get, they're like these little pinpoint little hemorrhages. So it is anaplasma is the only agent that specifically affects the platelets. And and so they can have, and when it's cyclic parasitism, cyclic follows a cycle. So every 7 to 14 days, they can, because, new platelets are going to be made. So, they infect those platelets drop, new platelets are made, those get infected, they drop. So this is why it follows like a cycle. It can kind of come and go, come and go. So it's mostly affects dogs, occasionally cats, sheep, but this is usually seen within 1 to 2 weeks following potentially contamination. Again, if there was a tick noted, ticks were removed, and then 2 weeks later, the owner notices bruising, and again, the difference with this is you're not seeing the stiff gait, the swollen limbs, the anorexia, flu-like symptoms. You're just seeing, so the clinical signs, may have a touch of fever, which not a lot of people pick up on in their animals. But they can see petechia. Now the difference between petechia and hemorrhage, technically petechia are the little broken blood vessels, little capillaries under the skin. Hemorrhage would be, do they have a nosebleed? Are they coughing up blood? Is there blood in the urine? Those are places that we look for hemorrhage. If I have a dog that has like immune, I'm going to step off for this topic for a minute. If you have a dog that has immune mediated thrombocytopenia, meaning their immune system is attacking their platelets, you worry about petechia, but you also worry about nosebleeds, coughing up blood, vomiting blood, urinating blood. And that tells you that they are bleeding into those areas. And it's pretty rare to see a nosebleed in a dog. Or it's, and again, blood in the urine, a lot of people are going to think UTI, but you also have to worry, is there blood in the urine because they have little hemorrhages in their bladder. So usually we can observe the organism in the platelets. So if you look in a smear, you can see this. I can tell you I have never seen this. It doesn't mean that it exists, but it doesn't exist. But this is a little bit rare. But if you're going to diagnose it, if you're looking at a smear, because sometimes when you suspect petechia, you need to look for platelets. If you suspect petechia, usually the doctor's going to want a blood smear to confirm that the animal has enough platelets. Even if you do a CBC, you also want to get an idea, are there enough platelets in circulation? Now, there is an IFA, which is an immunofluorescent assay test that can be sent to the lab. And there is an ELISA test that can detect this. So a few different ways that it can be diagnosed. But again, the treatment is going to be tetracycline. If they don't have tetracycline, then they probably would move on, because I know some clinics, most clinics carry about every antibiotic that we can, but a doctor may decide to carry one over the other. And a lot of times, if they want to do tetracycline, they might write a prescription for Walgreens and have the owner pick it up. So there's options but tetracycline would be the drug of choice. So there are some tests down here for tick-borne diseases. So there's the 3DX ELISA SNAP test. Now, the 3 means it tests for heartworm, Lyme, and Ehrlichia. Most of the time in your clinic, you probably just have the standard heartworm SNAP test that's just for heartworm. We don't need to be doing a 3DX ELISA on every animal, only if you suspect Lyme's disease or ehrlichiosis. And so some clinics, again, these are more expensive, may choose to not carry it and just send it to the lab and have that test run at their lab. There is a 4DX ELISA SNAP that does heartworm, Lyme, Ehrlichia, and anaplasma. So that 4DX covers, and you should know which organisms can be tested for in the 3DX and the 4DX. And you can just know them as Ehrlichia and anaplasma. So there's a note here that just refer to them as the Lyme, Ehrlichia, anaplasma. Now this 4DX, it'll pick up the different forms of anaplasma or the different forms of Ehrlichia, but it's just telling you that organism is present. If you wanted to know which one they had, you would have to, send that to the lab. But a lot of times the treatment's the same. So knowing which exact anaplasma or which Ehrlichia they had, not going to be as important as just confirming that they have it, choosing the appropriate treatment. Okay, so let me flip over to the other handout here. Okay, so no. Okay, so that's as far as the tick-borne illnesses. So now we're going to talk about the protozoal. And I know, again, you've probably talked about these in parasitology, so some of this might be reviewed, but that's nice. Sometimes it's nice to just review. But coccidiosis, it's an enteric infection, so it causes an infection within the intestine. And it is a protozoa. So we're looking, a protozoa is that single-celled organism. And that's what we're looking for when we diagnose it. It is Isospora canis in dogs and Isosporus felis in cats. And it is specific to the host. Okay, so they're going to, canis is specific to dog, felis is specific to cats. The number one thing that we see with this is a watery mucousy diarrhea. So, it can get severe to the point. Okay, it can get specific. So normally this is seen in puppies and kitties. It's a very common coccidia. It's a common, infection, protozoal infection. What you worry about is the younger they are, the more watery the diarrhea. Well, first of all, nutrients have to spend some time in the small intestine. Whenever you have diarrhea, things are going through. So first of all, they're getting lack of nutrients. They're also losing water into their intestine, and they can get very dehydrated very quickly. Now, the difference is the minute you see diarrhea in a puppy, everyone is like parvo, and you have to be, parvo is so contagious. Like, I'll give you an example. If someone comes to RER, they call and they say, I'm bringing in a 10-week-old puppy with watery diarrhea. We don't even let it in the building until we do a parvo test, because if it's parvo and it gets in the building and it's highly contagious, then we have to be a little more cautious. So a lot of times what we do is we go out to the car, do the parvo test, have them wait in the car. If they're parvo negative, then they come in the building and we proceed with our exam. But the difference is parvo diarrhea is very unique. I used to joke that I'm the world's cheapest parvo test because the smell is unique and it makes me very ill. Like, when I smell it, I have a very hard time dealing with parvo. I'm not grossed out by diarrhea, but the smell of parvo, it tends to look a little gray, can be bloody. It's very watery. And this is kind of a normal, could be brownish to tannish to green diarrhea, but it doesn't have that same smell. So again, if you're a clinic, you're always going to be cautious. You're not going to be like, oh, it doesn't smell, it must not be parvo. I'm not saying that, and I'm kind of joking. We would always confirm. But I just want to say that, parvo, when you have a puppy with diarrhea, parvo is way up there. Once we do that, then we kind of can go from there and confirm that it's not. So the dogs and cats, what we're looking for is they can shed the oocysts, and they may be asymptomatic. So you may be doing, and what happens is they come in for a normal puppy kitten exam, you do a standard fecal, and you may find it without the owner complaining of clinical signs as of yet. So this is what we're saying, is that if an animal is asymptomatic, that means without symptoms. They're carrying an illness, but they're not showing the symptoms as of yet. So it can be that it just hasn't built up enough. It hasn't caused systemic disease, but it still can be found on a fecal. So some concurrent diseases, it can cause infectious, it can be caused by iatrogenic immunosuppression or infectious immunosuppression in current diseases, meaning they're fighting another disease currently, and then this takes hold. So an iatrogenic, anytime you see the word iatrogenic, that is caused by treatment. So say, for example, we had a dog on prednisone for inflammation or something. And, that suppresses the immune system. And then all of a sudden, this this coccidiosis appears. So it can happen after getting treatment with immunosuppression, stresses, environmental changes. So what's common is, they get adopted from the shelter, or they get picked up at the pet store or from the breeder. And then the stress of changing their environment, sometimes that stress brings out, for example, kennel cough. It's very common for an animal to come from a shelter, a rescue, a pet store, and then be home for a few days and start coughing. And then everyone's like, well, they were fine when I first brought them home. Well, the stress of travel, the stress of a new environment, sometimes these, illnesses are subacute or subclinical, meaning they haven't emerged, and the stressful event causes their emergence. And that happens. There's not a lot you can do for that. That's just something that happens. It's a new environment. Things are going to change. And this is typically spread by oral to fecal contamination. So this is not spread by a bite. This is not spread by a mosquito. They literally have to contact it. So again, if fomites. A lot of people say, oh, it's spread by fomites. Well, a water bowl does not spread illness. There is something on the water bowl, like saliva or feces or urine. So a fomite is just an inanimate object that spreads illness. So a water bowl is a fomite. A doorknob is a fomite. A dog toy, towels, cage door. Those are all things that will harbor something that's going to spread illness. So, but this is spread via fecal contamination. So kind of how it starts is it is an oocyst. So an oocyst is in the feces. And then within a week, it becomes the infective form. It has two sporocytes, and then they form sporozoites. Now that's when now anything that spores, like when fungal yeast, when it forms a spore, and usually a spore, I kind of think of it like its offspring in a way. It's like a sporozoite is forming from an oocyst. And then, so there's 8 different infective forms, but I just want you to know when they ingest, the oocyst and the sporocyst release the sporozoites. And the sporozoites burrow into that intestinal lining, and that's where they finish their life cycle. So their life cycle starts in the intestine, and it's when these sporozoites penetrate. Now, once they develop, they're going to reproduce, and they're going to shed oocysts, and then they are going to form the sporocytes, and then they're going to form a sporozoite. And it's just going to continue to proliferate this life cycle. And then again, because this is in the intestinal lining, when that animal defecates, they kind of keep reinfecting. They step in feces, they lick their paw. If a cat is in a litter box and you don't get all the feces, most cats don't eat their own stool like dogs can. But if they are in a litter box and they step in the feces and they clean their paws, this is how this kind of keeps proliferating and moving on. So it's very common in dogs and cats. 3 to 38% of dogs, 3 to 36% of cats. So it's a very common. Most of the time we see it when they're young. Most of the time this is a puppy and kitten thing. And so they ingest the host and they start going through the stages. They are not typically zoonotic. So if we are cleaning their cages, if we come in contact with the feces, well, hopefully most people are. I think we've all been there. You grab a bowl, you realize, or you're picking up their poop with a poop bag, and you realize, not to be very descriptive, but, we would wash our hands. But typically, this isn't one that we have to worry about us getting, which is kind of nice. Now, the pre-patent period and environmental factors. When it's living outside, so if it's in the soil, developments to an infected sporulated oocyst. Now, sporulation is the formulation of spores. So when the oocyst becomes that infective stage, does not occur above 40 degrees Celsius or below 20 degrees. Now, sporulation can occur rapidly at temperatures between 32 and 37 degrees Celsius. So we do need some warmth for this to happen. The sporulated oocysts are pretty resistant, but they do tend to prefer the moist, protected environments. So if it's freezing in the yard or exposed to ice and snow, that's going to help. And if it's very, very hot, that's going to help. So if we're talking about this moderate temperature is when it tends to thrive in the environment. So again, definitely whenever you send home a puppy or a kitten with coccidia, definitely part of that client education is keeping things clean, keeping toys clean, bedding clean, picking up the yard. things of that nature. So usually to diagnose it, the signalment, are they young? What is their history? Did they recently just get this puppy? Did they come from a shelter? The clinical signs, and then seeing the actual oocysts in the feces, obviously diagnosing it via a fecal. Now, a standard flotation in a centrifuge, but it can be picked up. Not a lot of people do centrifugal, flotations. Most of the time, what you guys see at school is the regular fecal float, and you put a little feces in the little, you add fecosol, and then those oocysts float to the slide, and then you would diagnose it. Obviously, if you can do the centrifuge version, that's going to be a little bit more, that's going to be a little bit better diagnostic test, but doesn't have to be done. And you do need a decent amount. Usually owners are very good about bringing you like a gallon bag, and obviously we don't use all of that, but so the presence of oocysts, that's kind of what you're looking for to obviously diagnose it. But I will tell you, sometimes the doctor will be so strongly suspicious of coccidia, even if you don't find the oocysts on a fecal. I mean, usually if they've got pretty raging clinical signs, you're probably going to be able to find it on a fecal. Now, oocysts of Emeria can be seen, but dogs are not a typical host of the Emeria species. So it can look like coccidia, and these are referred to as a pseudoparasite because it looks like a parasite on the fecal, but it's not causing the clinical illness. And sometimes things are just picked up in the environment. But again, when I've done fecals, if you have one weird or one or two on a whole fecal slide, and I'm kind of like, is it this? If it's repeatable, then usually, you want to say hi? Hey, Jay, come here. I like when you say hi. Come here, Jay. No, you're not going to jump on my lap. Come here. Come here. Come on, say hi. No? Okay. Sometimes the doctor will go ahead and, okay, you are going to say hi. I know, sweetie. But sometimes the doctor will go ahead and treat. But again, if you're picking up that, which you'd have to, a lot of us in the clinic, you keep your parasite books, or the clinic will have a book in the lab. So if you're kind of like, is it this, is it this, you can kind of tell the difference. But these Emeria species, the oocysts never reach the 2-celled stage cycle. So they're not getting to what we typically see. So sulfamethoxine is the treatment, which is known as Albon. I know sometimes when you guys are going through all of these drugs and you're learning different medications, you'll know, like, we send Dronzit home for tapeworms. We send Albon home for coccidia. We send home Panicure for whipworms. Usually your clinic is going to have very standard medications, even though in school you learn different medications and different names and all of the different treatments you could do. There's always kind of a preferred treatment, and it's just been burned in my brain. Sulfamethoxine is Albon. Albon is the trade name. And that is the treatment for canine and feline coccidia. It's a liquid. It's actually kind of a white suspension. It actually smells really good. Whenever I filled Albon, I'm like, and I've not usually had animals have a problem taking it. So it's usually an oral liquid medication that they take home. There's different drugs and some combinations. Panazuril is a newer drug, but again, most clinics kind of stay with, we've used Albon for years, it works. Sometimes you have to repeat the course. If, anytime an animal has a high burden, I mean, sometimes I've seen slides, I literally focus and it's just coccidia. Like, it's everywhere. You know, sometimes those animals, a lot of times we'll do a 2 to 3 week course of Alban. We usually say bring back a fecal. We'll do a recheck. And sometimes you find you've definitely killed the majority of them, but you still have some present. Sometimes we'll repeat another round of the Alban treatment. So sometimes it's going to be repeated, or they may switch to a newer. I've never used Panazaril. Be honest, I've always used Alban, and that's just kind of what I'm used to. But again, talking to the owner about prevention and sanitation. You know, if they're in a house, you know, I just tell the owners, make sure you're going in the yard and picking up their stool. Not that they maybe want to bleach their yard and kill their grass. You can pour hot boiling water on it, you know, but normally if you just pick up the stool and you have moderate temperatures and cleaning any bedding, you know, if they stool, and sometimes puppies, you put them in a crate and they poop everywhere and they poop on toys that are in their crate. You know, they're going to have to bleach those. I'd put them in the sink. I know it sounds weird, run them through their dishwasher, maybe on a separate cycle, or soak them in the sink. Doing any bedding, you know, maybe getting, you know, usually if you wash them on like a hot cycle in the washing machine, that should be fine. So cleaning up, but especially in a kennel, if they've got more than one puppy, or catteries where they're breeding cats, that's going to be key. So really the daily removal, just go outside and pick up their feces every time they defecate. You know, once they are infective, some of the disinfectants are not going to be as effective. They can survive many months. But ammonia is a good cleaner to destroy these oocysts. But again, this and the other thing to think about, and I'm glad you know, sometimes I just try and give you tips. Whenever you use something like ammonia, and I don't know if you've ever cleaned with ammonia, but some of these cleaners are very strong. And if they're not diluted out properly, or they're used in stronger concentrations, if you don't remove it from the cage, and you put the animal back in there, the fumes can be very irritating. You know, what I kind of do if I clean a cage or I clean something, if you stick your head in there and it's bothering you, it's probably going to bother the animal. So if you're using this ammonia, you want to make sure you clean it off well, wipe it out well, so that there's not residue left behind. Now there's pressure washing and steam would be good. You know, if they have like an outdoor kennel, or maybe they want to take the crate outside and hose it down in the yard, or put boiling water. I know a lot of crates come with like a tray in the bottom, like a tray, maybe like soak the tray in bleach water outside, then rinse it really well. So there's options to clean. You know, sealing kennel floors, a lot of outdoor kennels, breeding kennels, you know, when they have the divots in the cement, you know, feces and things can get trapped in there. You want to make sure they're nice and clean. And the other thing is treatment of all incoctant animals, including bitches and queens. So a bitch is a female intact dog, and a queen is a female intact cat. So if you're treating puppies and kittens that are still with the mother, then you may have to run a course of treatment with her, because we don't want her to get infected. And, you know, the more that are infected, the more it continues to spread. So again, prevention is, you know, going to be key. The cleaning, the treating the other ones that are in the litter, and so forth. Are there any questions about that? I realized I didn't pull that up, but I was talking about the coccidia handout. Sorry, I didn't move that over. Are there any questions on coccidia?